Hello everyone, today my topic is healthcare-associated infections, patient safety, and healthy clinical workplace. Maintaining a safe and healthy clinical environment is to the benefit of hospitalized consumers as well as health workers. Among all the measures to maintaining a safe clinical environment, infection control has long been raised as a concern. In this presentation, I will use audio-visual resources and contemporary research findings to engage audience, discussing the concept of healthcare-associated infections, that is, HAIs, and the importance of infection control to patient safety and a healthy clinical workplace. Besides, it will discuss how leadership could mitigate these issues and how new graduate nurses can make their own contributions. Initially, HAIs referred to infections linked with acute care hospital admission. Now the concept of the term has expanded to various infections obtained by both patients and staff in various healthcare settings. Infection is considered as the second most significant causes of death in the world, and HAIs affecting at least 10% of the patients. HAIs often occur after hospital admission or within 1 month after receiving healthcare. Regarding the complications in hospital care, HAIs are the most common. In United States, according to a research carried out by Centers for Disease Control and Prevention, there was about 1 in 25 patients got HAIs during hospital stay. About 650,000 patients affected by HAIs annually. Patients are prone to developing infections in hospitals since the immune system is compromised. HAIs exert a significant financial and health burden on people affected and the whole health system as well. Surely, they are primary issues for contemporary nursing practice. As in Australia, 180,000 patients who suffered from HAIs had prolonged hospital stays, which in total consumed 2 million hospital days. The morbidity and mortality rate soared in this way. Those patients' quality of life is being reduced. In addition, there was a staggering amount of money cost on consumable items to treat the infections, and excessive utilization of health resources consumed. Over the past years, efforts have been made in many ways. For example, how to identify and isolate microbes, how to work out their major modes of transmission, and the sources of infections have been discovered by experts. A considerable effort aimed at HAIs reduction is underway worldwide. For example, WHO Patient Safety Clean Care Program. In America, Africa, and Europe, prevention and surveillance efforts have been made by International Nosocomial Infection Control Consortium. Initiatives have been carried out in many individual countries. Infection control has been deemed as a key to good health for a long time. However, when compared with classical medical science, infection control is relatively young as a science. Activities aiming at infection control and prevention are more likely to be just deemed as common sense since there is a shortage of robust evidence. Unlike diseases which cause worldwide public concerns like severe acute respiratory syndrome, infection control attracts little public attention. This kind of attention is disappointingly inadequate for maintaining patient safety as well as securing the healthy workplace for healthcare staff, as the staff is also at high risk of developing HAIs. According to a research which collected data from 9 healthcare organizations in US, no less than 18 million healthcare staff is at high risk of developing infections because of infectious respiratory illness exposures. After careful examination, it is found that the usage of respirators is infrequent. Some staff did not follow standard procedures, or they drew and drove incorrectly, or forgot to perform a seal check. It is noticeable that health professionals are at high risk of infectious disease exposures. Also, among health workers, it is found that about 40% of the hepatitis cases are the result of occupational exposures. Hand hygiene is deemed as a primary and most indispensable skill for infection control. Alcohol-based hand rub should be used, and when patients, visitors, health workers find their hands are soiled visibly, they should wash their hands with running water and liquid soap. Occupational assessment and vaccination are of significant importance. Each physician hospital organization must monitor and implement a risk-based immunization program for health workers, healthcare students, and clinical personnel, following the current New South Wales health policy directives. When patients need to be transferred, the department receiving the patients must be noticed of their colonization or infection status before transfer. Safe transport and handling patients' specimen is also essential when dealing with pathology specimens. Healthcare workers should ensure that the packages are sealed well and to maintain them under appropriate conditions through the whole process. When dealing with shared patient care equipment, healthcare workers should be careful about the cleanliness according to local procedures and manufacturers' instructions. Environmental cleaning includes the cleaning and disinfection of patients' areas during and after their hospitalization. For respiratory hygiene, everyone entering or working in healthcare facilities showing symptoms of acute respiratory infections should pay attention to hand hygiene and use single-use masks and practice cough etiquette. Adherence of standard precautions, including the proper use of PPE, personal protective equipment, disposing contaminated shops correctly, and management of biomedical and chemical waste, carrying out environment decontamination and cleaning procedure, and the management of patient line and waste. Leadership is highly valued in resolving these issues. Leaders should see supporting and promoting infection prevention and control as an indispensable part of the culture of the facility. Clinical leaders and managers from New South Wales public health organizations are accountable for evaluating and implementing systems to achieve this goal. Additional expertise and advice must be sought from skilled individuals, and an infection prevention and control committee is required. A bottom-up collaborative partnership in combination with strategic approaches is highly recommended to put infection control into practices and facilitate the development of clinical standards. Also, leaders can achieve this by listening to the concerns from the staff, engaging and motivating staff to follow the guidelines, overcoming management issues that affect HAIS prevention. As graduate nurses, we should bear in mind that we are health professionals. It is our responsibility to deliver safe care and ensure that we are capable for the practices. This standard includes self-management of practice and responding to other health workers' capability for practice. Regarding this issue, we need to have the know-how to apply the principles of infection control to practice. We are also responsible for the promotion of the concept and the skills of infection control to everybody visiting or working in healthcare facilities as educators. Infection control should not be deemed as an additional part of practices, but an essential part of standard care. That's my presentation. Thanks.